Hey everybody, this is Dr. Jen with Cedar Physical Therapy and Wellness here with Sarah, and I'm going to show you guys what a dolphin treatment looks like on a scar today. So Sarah has a scar here on her shin, and it's circular and it's a little bit smaller than a quarter size. So a scar should move in every direction, 12 o'clock, 1 o'clock, 2 o'clock, etc. So I'm going to check it out and see how Sarah's skin is moving around the scar. And it is not wanting to move very much in any direction. So now we're going to see if the scar is affecting any of Sarah's muscles. Sarah, will you pull your toes up towards your nose? I'm going to ask you to inhale and then exhale, and I'm going to gently bring your foot down. If you'll match my pressure, just stay in this position. Okay, breathe in, breathe out, match my pressure. Nice. Now we're going to turn your foot up and in. Breathe in, breathe out, match my pressure. Oh, so hold your foot here for me. Good. Breathe in, breathe out, match my pressure. So are you letting me take your foot?
Yeah.
Don't let me take it.
Okay.
So just hold right here. Breathe in, breathe out, match my pressure. So that one feels a little bit shaky. So now we're gonna bring your toes up and out. So if you'll bring your foot this way. And we're gonna turn your foot. Good, hold here for me. Breathe in, breathe out, match my pressure. That one's a little shaky too. So I'm gonna put my hand on the scar and then I'm gonna do it again and see if they change. Breathe in, breathe out, match my pressure. Do you feel the difference? How it doesn't shake? And then let's bring your foot up and in. Breathe in, breathe out, match my pressure. That's much better, much more solid. Do you feel the difference?
I can, yeah, and I can see the difference too.
Yeah, your foot's not kind of,
Yeah,
shoe's
it's
not
shaky.
kind of wiggling. Okay, then if you'll point your foot down for me. Breathe in, breathe out, match your pressure. So you just hold it down like you're pushing down on a gas pedal. Nice, and then we're gonna go down and in. Breathe in, breathe out, match your pressure. Perfect, and down and out. Breathe in, breathe out, match your pressure. Okay, so this scar is affecting the way your brain is finding your muscles right here and right here, which can affect the stability of the front of your ankle and the stability of your ankle joint. So we're gonna do the dolphin treatment on them. It's gonna be about 15 seconds at a time. If it's too uncomfortable, let me know and I'll turn them down. You may not feel anything at all, or it may feel like a sting or like a bee sting or a pinprick. And I'm just gonna kind of work my way because it's kind of circular around it. Ready? Okay. So it sounds like a dolphin. That's where it gets its name.
Oh, interesting. It helps you remember.
Mm-hmm. You doing okay?
Yeah.
So what I often see is that the color of a scar will lighten or fade, and this helps take out the trauma that your nervous system is experiencing from having scars, because scars put our nervous system more into fight or flight, and so this will help your body to be more in rest and digest, how we're supposed to hang out in our parasympathetic nervous system and not always like, oh, where's danger, where's danger. And the tissue is going to move better after we're done, because this helps to dissolve scar tissue. So where your fascia and connective tissue is stuck down, it's going to be freed up. That way we can start to work on getting it to move and glide and slide better. And then I'm going to give you specific homework to help reconnect your brain to the muscles in the front of your shin to give your brain a new way to move. Doing okay? Do you have any numbness or tingling or any abnormal sensation in your skin around these scars?
Sometimes I do, but it's only every once in a while. It almost feels like, because it's tight, the skin is tight, that it's like pulling sometimes.
Yep.
But it doesn't happen all the time. And I think it's been there since 6 or 7 years now. So I might be used to it even
Yeah.
when it happens. Yeah.
So how you felt it was pulling, it's because that scar tissue is holding your fascia, your connective tissue down. And our entire bodies are interwoven with fascia. And so every single muscle is connected to everywhere else in your body. Like, I could do something here on your shin that could affect you all the way up at your hip or your shoulder or your head, because everything's interconnected in our bodies. So that's why when things don't move, it's a really big deal locally, but it also can affect places in your body far away that you might not even consider are related, which is pretty cool.
It looks less tense or tight, like even in the short time you've
Yeah.
messed with it.
It's really cool because you can see scars change as you work on them a lot of the times. And this works on your scar tissue superficially, but also deeper too, based on how the current works between the two dolphin probes.
So it seems like it could even be like affecting like my balance in a way, I guess.
It can. Your brain gets information from balance based on your eyes, your inner ears, and information gets from the bottom of your feet. So if your brain is not finding muscles that help control your ankle as well, that can definitely throw your balance off if you don't have a stable base at your feet, which is definitely something that can be easily corrected. Yeah, it's definitely fading.
That's so crazy.
Wow, feel the difference?
Yes, I can definitely feel the difference. And I can see the difference.
Moving all the way in all these directions where it didn't move at all.
Yeah.
All right, for the finisher part, may I have 4 of your fingers like this? I need a measurement of your hand versus mine. All right, so 4 of yours is 5 of mine. So I'm gonna put my hand above your inner ankle, and there's an acupressure point right about in here that I'm gonna find. And the dolphin's gonna tell me when I find it. It's gonna start whining and my light's gonna go off. Awesome. All right, so this might feel a little bit different. Let me know if it's too much. this spot right here? Do you feel how it feels more hard?
Yeah.
Soften this little spot up. And there's some little band of scar tissue right here that I can feel. That's better.
Oh my gosh.
Softened up.
Well, the
Okay.
whole thing looks softer.
Yep.
You are my new best friend.
So now that we've gotten it to move in all directions, I want to get it to move. And we don't just want it to move in a straight line, we want it to move in along curves because our fascia and connective tissue is not linear. It wraps around and allows us to move and it's rotational. So we want to encourage movement in different directions as well as in straight lines.
I'm very curious as to like how I'm gonna feel like just going about doing things now. Like if I'll like
If you'll notice a difference, well,
Yeah.
we'll see in a minute. Look how much nicer this is moving. Like I can get it to rock and awesome. Now what I'd like for you to do is just pull your toes in and out for me with your foot up a couple of times each direction. Okay, and then I'm gonna get you to just go walk around for a minute and tell me if you notice anything different.
It feels different from the other leg even. Like more movable.
Yep. So now let's get your foot back up.
The same one?
Yes, ma'am.
Okay.
Let's pull your toes up and in.
Uh-huh.
So up and then bring your toes this way. Perfect. Breathe in. Breathe out. Match your pressure. Feel how solid it is, how it's not shaky.
Yeah.
And then bring your toes up and out.
It was
Breathe.
super shaky before.
Breathe in. Breathe out. Match your pressure. Congratulations, brain! You just reconnected with two muscles.
This is why I'm like, when I'm, like if I'm picking up something or whatever, like boxes and things, like I'm just thinking, I'm gonna notice like more stability, I feel like.
You definitely might.
Yeah.
Pretty cool.
Very cool.
So we're just gonna do the same thing for this one.
Okay.
Want to pull your toes up towards your nose for me?
Mm-hmm.
Breathe in. Breathe out. Good. And let's go up and in. Oh, that's fine. Yeah, that's good. Breathe in. Breathe out. Good. And then up and in. Breathe in. Breathe out.
I'm
Oh.
sorry.
That's good. Breathe in. Match your pressure. So that one's shaky. Okay. So we'll go up and in again. So if you'll swing your toes up this way for me. Rotate. Perfect. Hold here. Match your pressure. Yep. Okay. And then I'm gonna slide this back for a moment. If you'll put your foot down like a gas pedal. Breathe in. Breathe out. Good. And then down and in. If you'll come down and then in. Perfect. So point your toes down like a gas pedal. There you go. Breathe in. Breathe out. Good. And then down and out. Ah, we rolled your whole hip with that one. So that might be a thing to check on later because you used your whole hip to compensate for your foot turning
I'm not
that way.
surprised.
Okay, so breathe in. Breathe out. Yeah. Breathe in. Breathe out. Yeah, I think that was a hip foot issue. We'll have to check that one out.
She's like,
That's
I'm
fine.
finding more things wrong with you.
All right, so let's check out the movement on this one first. So we're gonna go 12 o'clock. Can you pull your pant
Yeah.
leg up a little bit for me? Perfect. Alright, so 12 o'clock, a little give. 1 o'clock, 2 o'clock, 3 o'clock. 4 o'clock's got a little give, 5 o'clock's got a little. Doesn't want to move hardly at all. This 9 o'clock direction is pretty stuck. 10 o'clock's pretty stuck, 11 o'clock. So this portion is the most stuck.
Okay.
But overall, compared to how we got that side to move, it's still not moving super great.
This is the newer one
Okay.
of the two, but still, again, a good probably 6 years
Yeah.
of stuckness.
No. Does this one feel different?
I think it feels a little bit. I've always noticed a difference between the two, but I've also wondered if that was because they took the skin sample from this one. Like, I don't remember which one it is, but one of them I feel like is more likely to bother me sometimes than the other.
Yeah, the dolphin the pitch changed when I hit that spot. I was just wondering if it felt any different.
Which now that you've mentioned like surgery or whatever, like making adjustments in this, because they took that skin sample, it could have also done something when they did that, maybe? No?
It's
Adjusted it at all, or? It changed the healing like it looks a little bit different.
It does, yeah.
And they made me sign something.
Was it like a deeper incision, or because they had to do a
It
biopsy?
hurt.
Yeah.
I was like, you're taking a small skin sample and it hurt that bad?
Yeah. Well, I mean, it's like a good cut. You know,
Yeah.
sometimes the little ones hurt more than the big ones. You know, like paper cuts hurt more than
True.
bigger ones sometimes. So you've got this little spot on this one that's kind of brown in the middle. I'm gonna go a little bit closer and on that brown spot and see.
I think that's from where they took the sample.
Oh, that's the spot. Okay.
Yeah.
I'll do a pass through the middle here. to the inside of this ankle. There we go. Alright, there's my sweet spot. Feels really soft. Yeah, I'm not feeling as much tight tissue in this one as the other one.
The other one has been there maybe a year longer. I don't know if that's why.
Right there has a little bit. Okay.